And what was supposed to improve care for Ohioans with disabilities while saving taxpayers money has actually ended up costing some small business owners.
Tonight, Natalie Tyndall with 2 News Investigates uncovers the reason why and asks why these providers are stuck with the bill.
Well, they help care for low-income Ohioans with disabilities, but several Medicaid providers in the Miami Valley reached out to 2 News Investigates over the last few months saying they were not getting paid. We spoke with one local woman who almost lost her business because of it. Tanya Ellis and her husband Frank have had a rough few months.
It's really hurt us a lot. I actually had to sell my car to make ends meet.
They transport Medicaid patients to the doctor's office, dialysis, and to the hospital. But in July, they stopped getting paid for a majority of their runs. It was their only source of income.
We got to have gas. We had to pay for insurance. We got to pay bills.
Ohio changed the way it handled some Medicaid claims this year by implementing a 3-year test program called MyCare Ohio. The goal is to create a more efficient system to integrate care for those on both Medicaid and Medicare. It would also save you, the taxpayer, money in the long run. Ohio is currently testing out this idea in 29 counties, including the Miami Valley. Instead of getting paid directly by the government, providers like Ellis now have to go through private managed care plans assigned to their area. Ellis said her trouble started with the company Buckeye Health Plan. When we first started asking questions, she said Buckeye owed her $7,234 for transporting patients.
But since they took over, it's been a disaster.
2 News Investigates found Ellis wasn't the only provider not getting paid. We received several calls from others in the same situation. So we tracked down Beverly Laubert. She's the state's long-term care ombudsman, the one who deals with complaints against the program.
Why weren't these companies, these providers getting paid?
Well, I think there are communication issues.
Laubert says since MyCare's implementation in May, they've had 195 complaints, and she's aware of several issues involving home health providers not getting paid.
We had some issues up front with some of the smaller independent providers having issues with their claims and being paid by the managed care companies. So that was one of probably the kinks that was most talked about.
Buckeye admitted to the payment problem with Ellis. They told 2 News in part, quote, Buckeye was experiencing communication issues on what services the provider was providing. As it became more clear what the services were, we were able to give the provider a clear direction on how to proceed going forward and how to submit claims for those services. Laubert says there's an intense review of everything happening with the MyCare test program. She says all kinks are reported to state and federal agencies.
So do you think that issue is being fixed?
It is, yes, a little at a time. I'm sure that there are some people, especially those who feel that they're not being paid fast enough. It's probably not moving fast enough, but yes, they are. They have a list. They're working through their list.
Since 2 News Investigates started asking questions, Ellis has received a majority of the money she was owed. But that hasn't changed her mind when it comes to the new program. She has a strong message for those behind it.
They're not organized at all. They need to really communicate better so everybody's on one page.
Now, Laubert said the providers who are not getting paid need to take their own action by contacting these private health care plans as well as the state to let them know there's a problem. She said the director of Medicaid has been very vocal in letting the managed care companies know they need to get this problem straightened out. Natalie Tyndall, 2 News Investigates.